Okay, great. We're going to get the webinar started now. Hi everyone, I'm Hayley Millard. I'm a digital researcher in the Ipsos healthcare team, and I'd like to welcome you to our self-care webinar today in collaboration with PAGB. Self-Care Week is designed to raise awareness around the importance of thinking proactively and preventatively about health and well-being each year, and improve understanding amongst organizations, healthcare professionals, and individuals on why this is becoming more and more essential. During our webinar today, all lines will be muted throughout the presentation to avoid any background noise. If you find that your microphone has been switched on at any time, please mute it again through your control panel in the webinar platform. We'd really appreciate that. We will have 10 minutes at the end of the webinar to answer any questions, and you can submit these via your control panel at any time. This webinar will also be recorded, and a link to the recording and slides will be sent to you this week. I'd now like to introduce our expert panel. We'll be hearing from Dr. Hamali Patel, a practicing physician in California with a focus on lifestyle medicine, Fran Ayalasa-Mayajala, Worldwide Head of Population Health at HP, and John Smith, Chief Executive at the Proprietary Association of Great Britain. And through this webinar today, we'd like to go through opportunities that can be gained through technology-enabled self-care, how technology can enable people to take more control of their health, and the role of health services and industry stakeholders in designing and communicating services to support this. And I'd now like to hand over to our first speaker, Dr. Hamali Patel.
Thank you so much, Hayley, and thank you for having me today. It's a pleasure to be participating in this webinar, specifically as it pertains to an area that's very near and dear to my heart, which is the importance of self-care. Happy Self-Care Week, UK. The following describes the definition of self-care directly from the dictionary, but to summarize, it's really fundamentally about ensuring that people can access the care, advice, and treatment required to manage their own health and well-being to the best of their abilities. Personally, as a physician who has worked both in an inpatient hospital setting and now as an outpatient clinician, I've had the opportunity to see individuals from a multitude of backgrounds come in with varying levels of chronic disease that, if detected earlier and had been better managed, would have resulted in far less ER visits, hospitalizations, and decreased visits to their clinician. An ethos of my clinical practice is to empower individuals to be in the driver's seat of their own health, using evidence-based medicine and best practices to educate individuals on the state of their health, supporting and empowering them to make good decisions and equipping them with tools they need to succeed in their journey. And this is a spectrum, so making good decisions and starting at an early stage from a preventative standpoint all the way through to post-hospital discharge and long-term care is really the realm of what we're looking at when we discuss self-care. And from a physician standpoint, there's an opportunity gained through technology to enable self-care in a way that can support and augment health and well-being for an individual and really allow one to be an active participant in their own health, where the internist, GP, primary care physician still plays a pivotal role and is still very much involved as part of your care team, but many of the day-to-day ailments you currently see your primary care physician for can be taken care of using other modalities outside of a typical clinical setting. And studies have shown that when you activate patients to participate fully in their care, you unlock potential to make strides towards healthcare's important goals, such as better outcomes at lower costs with a better patient experience along the way. So moving on to chronic disease in particular, it's become a hot topic of conversation, particularly as we're seeing that there's such a growing burden of this in our society. To elaborate and to extend on that, chronic disease is defined as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living. As you can see on the left of my slide, it's quite an extensive list, with it continuously growing and being added to. I place mental health on there as new research has found not only a significant association between psychiatric impairments and chronic disease, but also that the odds of having a psychiatric disorder increase with the number of chronic illnesses affecting an individual. Currently, chronic disease such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. From a health economic standpoint, it's staggering to know that chronic disease accounts for 90% of the nation's $3.5 trillion in annual healthcare expenditure. And when we talk about this from a population health standpoint, we are seeing trends that are concerning and rising, such as a younger population being diagnosed with definable chronic disease. Obesity affects almost 1 in 5 children, 1 in 3 adults, and costs the U.S. health system $147 billion a year. That, coupled with an increased aging population wanting to live independently, is likely going to cause significant distress in our healthcare system and society as a whole if we don't start to take efforts to change. And for those of you who read the Lancet report last week on health and climate change, to quote directly from the report, left unabated, climate change will define the health profile of current and future generations and will challenge already overwhelmed health systems and undermine progress towards the UN Sustainable Developmental Goals and universal health coverage. So, looking at all these factors, it really is important to start getting patients used to, or individuals used to, being in charge of their own healthcare just from a disease prevention standpoint. And it's not all doom and gloom. I don't mean to paint a dark picture. Technologies are coming to bear that can actually help us deal with these challenges. And it's very exciting to see what is being done in a primary care setting, but also outside, allowing individuals to take more of a pivotal role in their health and relieving burden off the healthcare system. Clinicians, we tend to focus on what's going on in the system, but there's a growing trend of moving outside of that. And this schematic is actually very nice, from everywhere from what is actually happening in a hospital setting, moving all the way out to before you even walk in to see a primary care physician, what is being done in the technology realm. So examples of this and trends that we are seeing are such things as remote patient monitoring, utilizing blood pressure devices that sync up to your primary care's electronic health records that will notify your care team of blood pressure readings. Instead of you coming into the clinic to have to get these readings done and then your meds adjusted, we're now having patients being able to have a coach call them and have them adjust based on the readings that they're sending in from home. Continuous glucose monitoring is another device that is actually helping diabetics understand the role and effect food and lifestyle has on their glucose. It also allows insulin-dependent diabetics to have more freedom and autonomy to live their lives independently, improving quality of life, reducing resources needed to constantly finger stick, and aiding care teams to see what's happening with their readings to avoid the pitfalls of patients coming into the hospital with hypo or hyperglycemic episodes. EKG and heart rhythm monitoring is another type of remote patient monitoring that's really allowing patients to track their conditions and send it directly to their physicians. And as we've all seen, almost all consumers now have access to devices with sensors that can collect valuable data about their health, from smartphones with step trackers to wearables that can track a heartbeat around the clock. We're seeing a growing proportion of health-related data that's generated on the go, which is actually really helping physicians understand their patients more, but also helping patients understand themselves a little bit more as well. Moving further down the triangle, telehealth has been around for a very long time, but we're seeing more apps being created that make it easier for patients to get help from where they are. Here at my clinic at One Medical, we have a healthcare-based app that links our electronic health records to a Treat Me Now button, where patients can directly access healthcare providers, otherwise known as our virtual medical team, to get real-time help in diagnosis, clarification, education on conditions that would typically drive them into the clinic. And we're seeing a lot of this in the space of mental health as well, patients being allowed to develop their own resilience using telehealth applications or moments of panic attacks and anxiety attacks, really being able to get someone live in the space that they're at without driving them into the hospital or an ER. In the realm of artificial intelligence, it's actually a very exciting area for clinicians, particularly as patient structure evolves and payment structure evolves. Patients are demanding more from their providers, and the volume of available data continues to increase. So AI is actually allowing us to more effectively and efficiently aggregate patients' history using electronic health records to create more intuitive interfaces and automate some of the routine processes that consume so much of our time. So instead of in clinic going through someone's healthcare records to find out what vaccination they've had or what their past medical history entails, AI analytics is actually able to pull that, so it's ready for us to use. And there are deep learning startups that are focused on medical imaging analysis, aiming to provide cost and time-saving opportunities for doctors by enhancing detection and diagnosis. And with the FDA approval of AI-powered diagnostic devices for diabetic retinopathy, screening is actually really being helpful in the detection of diabetes that we're seeing so early on in patients. Voice-assisted technology, we've already been seeing in the hospital, specifically in ICUs and amongst stroke patients using remote neurologists and intensivists. But it's also now being used outside of the hospital, and it's been great for the elderly population. It's been wonderful to help patients get educated on certain disease states. There's reminder cues now for medications and for appointments. It's also really improving the physician experience from having virtual health assistants to voice-enabled solutions. It's really been the forefront of many conversations in primary care. And while a lot of it is still in the phase of pilot projects, learning how to best utilize and integrate these technologies is really exciting to see. And we're seeing certain hospital systems that are using Alexa as a healthcare assistant in ICUs and to support services to educate parents with sick children. And with Amazon's recent acquisition of PillPack, there may also be an opportunity for patients to start using voice technology to order their medications via Alexa. Most interestingly, Microsoft and UPMC is partnering to trial a voice-enabled scribe called Project Empower MD, which basically uses ambient intelligence that takes care of routine tasks, letting clinicians focus on what we do best, which is taking care of patients. And this actually really enhances the provider-patient experience. And digital innovation in itself is also driving a lot of this. And lastly, looking at human genomics, we're seeing an emerging medical discipline that involves using genomic information about an individual as part of their clinical care from a diagnostic and therapeutic decision-making standpoint. And we're seeing a lot of health outcomes and policy implications of genomic medicine being used already. So it's making an impact in the fields of oncology, pharmacology, but we're also seeing it driving preventative care for what patients may be starting to trend towards. So while this is all very exciting and significant, there's a significant amount of onboarding and training that needs to be done, both for clinicians and patients, to have this technology used correctly. I think simply just giving a blood pressure remote monitoring device to a patient and wishing them luck can actually cause more distress and anxiety to an individual, potentially backfiring on a system that's geared to do just the opposite. So there's got to be basic understanding, adherence, and access, and I believe I will pass it over to Fran to discuss more about that.
Great, thank you, Dr. Patel. You know, I think the biggest opportunity here is what the advancements in the technology really enable from an individual's perspective, enabling them to be able to take full ownership of their health and their health journey in ways that they haven't been able to do before. And this progress that we have seen really allows us to take stock on all the advancements that we've been able to make. For example, the increase that we've actually seen overall in the adoption of digital technology. You know, one of the things obviously that's driving towards this is the design of technology in ways that are more simple to utilize, as well as certainly the cost of the technology itself coming down has made us a tremendous difference. So much so that when you look at technologies such as the use of mobile phones as an example, we have staggering statistics. As an example, quite literally today, there are more people with access to mobile phones than there are to good, clean drinking water. And while there are lots of messages that we could debate and talk about in regards to that, one of the ones I'd really like to be able to emphasize today is that how the ubiquity of this technology then as a result has really created for some opportunity in terms of self-care. A great example of this is the World Health Organization. The Be Healthy, Be Mobile, Be Healthy program is focused on really providing access to educational information that's driving towards patients making better behavioral choices, individuals having access to educational information that they might not otherwise have access to. For example, being able to communicate at a broad scale signs and symptoms of a condition, or measures to take when those signs and symptoms arise. And so we're really seeing now the progress that's being made as a result of technology becoming part of everyone's daily life. The convenience of these technologies are also having a very significant impact. The other element of that is the digital delivery models that are also coming into creation. And, in many respects, we're going to spend some time on this in the next couple of slides, because it's really one of the things where we have an opportunity to make for significant improvement. But when it's done right, these digital delivery models have been very successful in being able to ensure that patients not only have access, but are able to interact with the technology in ways that prove beneficial for them. And lastly, the financial stability overall. One of the challenges that we have in industry, in the healthcare industry, obviously, is the ever-rising cost of healthcare. It has been uniformly recognized that by enabling individuals to have the opportunity to directly take ownership of their health and leveraging technology and some of the fundamental principles, if you will, of public health, are what are going to allow for us to have cost containment and what seems to be ever rising challenges around and costs surrounding healthcare. And what's refreshing is that both patients and clinicians are actually ready for it. And what we'll see on the next slide is, when it comes to patients in particular, what they're most interested in is that they have a relationship, a partnership with their providers, that it's not just that the old paradigm in which the patient is solely dependent upon the knowledge, the expertise, and the support of the provider is not the case for the individual and for patients today. We all know the saying that information is knowledge, right? Information is power, and with that, then patients are recognizing that too. One of the things that Dr. Patel had gave the example of was being able to have access to biometric information. Now that patients are able, whether it's a wearable device or whether it's even the use of some more conventional devices like blood pressure monitors, being able to have access to that data, both from devices as well as from patient portals, as an example, allows for them the opportunity to start really actively participating in shared decision making, and in some cases even initiating self-directed care, which is one of the things that we see when patients elect to leverage over the counter products and medications, as an example. So all of these things are really key. Certainly, the creation of a supportive network is more so what patients are looking for, and this interconnectedness with their clinicians. When we have asked in studies of individuals, like, what are the things that they're most looking forward to, or the greatest expectations that they have in terms of their adoption of technology, it's centered around the ability to have better relationships with their providers, that they are more interconnected with the key individuals within their community, whether that is with organizations that help provide social services, or even with their personal caregivers, friends, and family. So these are major attributes that make a huge difference in the paradigm. And even as we try to visually depict this, as you see to the slide on the right, the thing that becomes most apparent is there is this shift from moving care from simply being something static that happens within the four walls of a clinical environment to something that's very dynamic. The relationships and the support systems become dynamic, and that is actually something that occurs beyond the hospital facilities or the clinical facilities. I mean, the reality is that people only spend less than 1% of their lifetime in a clinical environment, but their health stays with them. So the technology is enabling this. But in order for them to be able to take good advantage of the technology, to get the most out of it, and not just for the individual, but also for the clinicians, we must design in such a way that enables that to occur. And so what I'd like to emphasize on the next slide is how universal design and universal access are really paramount. They're really key to making this happen. First and foremost, consumers need choice. I used the example of the mobile phone, but the mobile phone, while it created sort of it began to sort of introduce an equalizer, if you will, amongst so many around the world, irrespective of their economic or social economic stance. It is only one technology form factor, what we call in the digital space as a form factor, that is available, and it may not be the optimum one for every end user. As Dr. Patel had pointed out, we have a shift in demographic that is occurring every day. Over 10,000 people are turning the age of 65, and while this change is occurring and there may be some challenges, technology can play a difference. But the only way it will play a difference is if we acknowledge certain key things, that individuals have preference in terms of the technology they use. You ask a younger individual, right? You ask my son, who's 8 years old, there's no surprise. He came to me and said, I want an iPhone 11. What he's going to do with the iPhone 11, I have no idea. He's got lots of ideas around that. But when I ask an older adult, I ask my great aunt, who's 90, literally 99, going to be 100 years in 2020. She says to me, I want to be able to use my desktop computer, and that's what she uses, her desktop computer, and she uses that to connect with the rest of the world. Yeah, those sound like anecdotal stories, but when I tell you that we've been surveying hundreds of older adults, and that the results and the feedback that we're getting is consistent, then there's something for us to look at. So as you're deploying these programs, it's important to consider, are you introducing technologies that will help to empower individuals to participate to the best of their ability? And things like the severity of their disease state and the complexity of those disease states make a difference as well. Someone with limited dexterity or who is suffering from dementia, as an example, on a spectrum, may be able to use technology, and we've conducted studies that show that they've been able to. But on their own, and just assuming that a mobile phone device is the optimum device, is a big mistake, and we're seeing that in some of the studies that aren't deriving at the desirable outcomes that we're trying to achieve. But when we mix it up and we start bringing and introducing technology that they're familiar with, that they've been oriented towards, it makes a huge difference. And that's why education is so important. Orientation to the technology, ensuring the familiarity, level setting on expectations also becomes very key. Learning modality is also a key one, and this is sort of a crossover between, the visual, auditory, kinesthetic ways in which people learn also have to do with the way that they interact and how they behave, their behavioral attitudes as well. And so as you're creating these programs, looking to those dynamics as you create choices for individuals. And we have seen in studies where the way that the programs are designed, and not just the technology, but the overall programs, the way that the technologies are introduced, have a big make a big impact on the way that the individual, when they take these technologies home and try to utilize them as a component of self-care, how successful they are with them. And I use the example of VR, as you see on the end, because it really kind of emphasizes the experience that individuals want. You know, how simplistically one can open the box, the plug and play, as we like to call it. I often give the example of, you know, when you open an HP printer for the first time, how easy it is to pull it out of the box, plug it in, that the printer itself tells you what to do. Is a great example of how simple you want for the experience to be. The individual consumer wants to be connected, always connected. They want to know and have that the confidence that comes with the care that they've been given in a facility by a physician is in part directly correlated to how well connected they feel with that clinician once they leave that facility. Being able to know that even amongst older adults who tend to have limited mobility, that when they have the opportunity to get out and about, to visit their grandkids or to take that vacation, that they're still connected is really important, and that we do this in simple ways where they're fully supported from a care perspective as well as from a technology perspective. And then just moving one step beyond that on the next slide, what we really want to be able to foster, and what we're beginning to see coming to bear with this technology, this combination of the self-care, that is where the individual is sort of initiating the process of care for themselves and for their loved ones, that all of a sudden the dynamics of the system changes. The access to information, both for that individual and the individuals they care for, as well as for the provider, and not just the provider, but also for all of the ancillary services that are part of that self-care, begin to change. And as they are woven together, we begin to see a whole new dynamic in terms of the engagement of very diverse players within the ecosystem. I give the example here of Meals on Wheels. Meals on Wheels is a program that delivers food into the home of individuals, oftentimes individuals who need social services to support them in being able to have access to food. And, you know, when we talk about some of the behavior changes that we know from a preventative perspective that need to take place when individuals, as an example, are trying to manage conditions like a cardiovascular disease, then we know that there are changes in their eating habits, as an example, that need to occur. But do they have access to the balanced meals, the low sodium diet that they need, the education around that, and how organizations like a Meals on Wheels can participate in that program by having access to this information, and by the individual themselves being able to elect to have access to participate, is really interesting. Transportation, we know to be a huge problem. One of the major factors to no-show rates within facilities has to do with the fact that individuals not only sometimes don't understand why it's important to have that follow-up visit, but also because they have difficulty being able to have access to transportation to get them to that visit. And so introducing programs like Uber as an example, or telehealth, which could be easily introduced here, create for really new changes in those ecosystems that get stimulated by this new sort of supportive care model, if you will, that comes to bear when individuals are empowered with technology as a component of their self-health journey. And lastly on this one, what I think is also pretty awesome is how we see this as a result of increased self-care. We see a shift in the roles and relationships. I love Topol's book, The Patient Will See You Now, and if you haven't read that, it's one I encourage you to read. There are many more like it, and you undoubtedly have many thoughts of your own on it. But essentially what is occurring is this sort of on-demand system. When I'm needing care, that I know that I can get access to care, and dare I say, instant gratification in this context has actually worked in the favor of the consumer, in so much as now there are resources that can help support them. But all of these dynamics that we see taking place require a system of trust. And as I've outlined in my final slide, and what we have seen from studies that have taken place is one of the most recent ones being the COMPARE study, where over 1,000 patients were surveyed to look at their thoughts on this new systems of digital health and use of AI and other technologies. What has been consistent, not only in the study, but in the many studies that we have actually conducted, and those of which, in fact, Ipsos has conducted, is that privacy, security, fraud prevention are at the top. Issues around data ownership are still continue to be of concern. Technical support. If you're going to give someone, or if you're going to give someone a program or access to a program, even if it's something so simple as an app, a mobile app, you have to be prepared to support those patients, particularly if we are electing or mandating, if you will, that this is the new model of care. If it's the new model of care, then there needs to be a new measure of support, and these are the types of things that HP is very much focused on. Consolidation of programs is also paramount. There are a lot of overlaps, as we all know, even looking at vital signs, a lot of overlap between the data that's needed to manage a patient who has hypertension and a patient who has diabetes. Oftentimes, these are comorbidities that unfortunately come hand in hand together. But does this mean that we need to have double the apps? Like, how many apps does an individual need? There are literally over 1 million apps available that are out there on the market. How do we consolidate some of this and make sure that the best of the best is brought to the top, that both patients and providers are actually educated on them? And when individual consumers are making a choice to start to take on self-care, that they are able to do so with confidence, that there's validity and credibility in the tools that they elect to use. I have now started to look at this, and you'll be seeing some articles coming from me on this very soon, have decided that what we really need is something similar to what we have with pharmacovigilance, right? But I'm calling it digital health technology vigilance. That it's not enough to put a technology out there. We need to be monitoring the technology and ensuring the safety and the security, and that there should be reporting measures that are put into place. Have you employed those for your programs? And as we create programs for individuals to take on self-care, that we ensure that in creating those models of self-care, that we allow not just access to information about the benefits of those tools and technologies, but also that there is an outlet through which they can report back when things go awry or are not going to expectation. And lastly, but perhaps most importantly, what patients want, what individuals want, is not just the tech and the autonomy, but they also want to continue to have the touch. And if there's anything in the red that you see in the star, as I like to call it, this graphic of a star, is a concern that that there would be less touch. The healing takes place with the human connection. And that goes back to that first slide where I talked about interconnectivity. That stays true here. And in fact, we know from some of the most oldest studies that the biggest human element, the difference between even a newborn, those who have access and are connecting with other humans, even orphans in South America were studied, where they were some were not given any interaction with humans. And as a result, their health failed. But those that were connected, and the nurses and the other members of the staff would come in and interact with them, they were the healthiest. And so this is not about a way to distance ourselves. It's about a way to keep ourselves connected with one another for the ultimate of well-being and health. And with that, I'm really excited to pass it on to John Smith, who will share more of some examples of this.
Thank you very much, Fran. Very interesting. So over the next 10 minutes, I'm planning to explain why self-care is so important to the consumer healthcare industry in the UK. Talk a little bit about how digital technology can support self-care and what's required to embed self-care within the NHS in the UK digital arena. I think you heard earlier, it is Self-Care Week, so happy Self-Care Week. It runs from the 18th to the 24th of November 2019. And the title of this year is Think Self-Care for Life. So, if we move on to who is the PAGB? So who are we? We're the Consumer Healthcare Association, and we represent manufacturers of branded OTC medicines, self-care medical devices and food supplements in the UK. And we're actually celebrating our 100 years this year, so it's a really great time to be the chief exec of the PAGB. And why did we got set up? I mean, you heard about trust. Back in 1919, 15 founder members formed a trade association because there wasn't trust in the industry, and the advertising that was going out there, consumers couldn't rely on. It's really interesting. I've got a poster in my office, and it talks about the carbolic smoke ball company that can cure cough in a week, influenza in 24 hours, and cold in the head cured in 12 hours. And that was what was happening back in 1892. So let's look who are our key members now. And you can see the members up there. We've got 45 members at this time, and we also have 36 associate members. In terms of value in the UK, we represent about 65% of the market, and we have 48 of the top 50 consumer healthcare brands. What's our purpose? Our purpose, why we were set up in 1919, was about advertising and promotion of OTC products that is responsible and not misleading, so the consumers can trust what they're seeing. We also want to see a regulatory environment that supports access to OTC products. A good example is we want to see more switch. We want to see products moving from the prescription only to the UK to a P category or to a GSL category. But what we're going to talk about today is policies that empower people to self-care for self-treatable conditions. So all of those three put together, what we're looking for is a healthy consumer healthcare industry in the UK. So why is self-care important? It's really interesting. In the UK, there are 18 million GP appointments in a year for self-treatable conditions. And I'm amazed by some of these. I mean, 40,000 GP appointments for dandruff, over 1 million for backache, 5.2 million for blocked noses. So you can see there's a significant number of people still going to their GP when they could be looking after themselves and self-treating. So what's that costing us? And looking at the next slide, you can see that overall it is costing us 1.5 billion that could be saved and reinvested elsewhere. You saw the 18 million visits that I talked about earlier. That's costing 810 million pounds. But you can see the other aspects, the A&E attendances, people going to the A&E and looking for advice and guidance. If they were diverted to the right place, that would save over 500 million pounds. If we could use NHS 111 better, again, direct people to self-care or to the most appropriate source rather than send them into the A&E or the GP. And also, if we could reduce the number of prescriptions for OTC products. I know that's already started, and I know there is a guidance out to GPs about conditions for which over-the-counter items should not routinely be prescribed in primary care. And this guidance is given to CCGs. But it's not getting to the number we're looking for because GPs are still prescribing OTC medicines. So what are we doing? What are we trying to look for as the PAGB? And we've highlighted these savings in our white paper. What we're really calling for in this white paper is a national strategy in self-care to support a meaningful shift towards empowering more people to self-care. So what will that do? That will reduce the demand on an overstretched NHS that everyone loves and wants to keep. And some of our key asks are introduce recommendation prescriptions for GPs, enable community pharmacists to refer people to other healthcare professionals fast-track if necessary, and give community pharmacists right access to medical records. But we followed that up because technology is playing a bigger and bigger role. And so we followed up in August this year with a new report, harnessing the potential of technology to transform self-care. So within the NHS, there is a significant focus on digital transformation. And a lot's been driven by the Secretary of State for Health, Matt Hancock. Efforts to use technology to deliver cost savings are generally very positive, and we are very supportive of this. And NHSX has been set up to coordinate and drive transformation. Trouble is, as often happens within self-care, there's a lot of examples of individual projects to improve data sharing, collaboration between primary care and pharmacy, or to support people to self-care. In our view, what is lacking is a national strategy on leadership and coordination. In order to highlight some recommendations, as you can see above the 6, we produced this report in August 2019. This looks at areas where technology is already supporting self-care across the world and makes recommendations for how this can be applied to the UK. So what else is in this report? This is a self-care continuum that was actually invented by the Self-Care Foundation, Self-Care Forum, sorry. And it's a way of showing different elements of self-care for individual responsibility, from individual responsibility right through to acute in-hospital care. Discussions often focus on how digital technology can improve hospital-based care, enable access to GPs, or support people with long-term conditions. We are focused on how digital technology can support the other end of the self-care continuum. We're really interested in how technology can help in healthy living and self-treatable conditions. So what are the things we think that could do? And looking at the next slide, we're now looking at the left-hand side of the self-care continuum. And we're looking at digital technology. So what do we think could be done? Obviously, people go online for information and advice. More and more people are wearing lifestyle apps and wearables. There's the online symptom checkers and digital triage systems. And obviously, there's integrated electronic health records. All of these play in the healthy living self-treatable conditions part of the self-care continuum. So in these 10 minutes, let me give you a few stats. And certainly in the UK, 54% of adults looked online for health-related information, and that's certainly up from 2008 when it was only 25%. And about 2/3 of those aged 18 to 35 use some kind of digital device, mobile app, like a Fitbit, to try and track or keep on top of health and well-being. So people are definitely going online, but we're seeing that people don't trust what they're seeing online. And our research shows that 25% of people don't actually trust the data provided by health and wellbeing apps. People need to be able to trust online resources. And these online resources have got to include an easily understood section on self-care. Moving on, let me show you an example of a success in the Dudley CCG, where they were trying to move away from the GPs. And they introduced the Ask NHS app using Olivia, a virtual nurse, to access users' needs and direct them to the most appropriate service. So this is what we're looking at. We want to see people being directed to the right place and not always going to the GP. But not all online checkers and digital triage work in this way. Those which offer to connect people directly to GPs threaten to increase demand on GP time. It's important that self-care is top of mind when developing systems, and that pharmacists' role, as we see as really key in the UK, in self-care is absolutely recognised. So let me wrap up with our 3 recommendations. I've already talked about the action is needed to encourage greater use of tested, reliable and trustworthy online sources. I mean, we need recommended NHS website and apps that should include a section on dedicated to self-care, that has fact sheets from the Self-Care Forum, and it has easily understood videos to improve people's understanding of self-care. We obviously want to see that the online triage directs people based on symptoms and signposts to local pharmacies for self-treatable conditions, rather than connects them to the GP. Our last recommendation I'm going to talk about today, that I'm not giving you an example, but it's pretty easily understood. We want to see community pharmacies having right access to patients' medical records and bringing them absolutely into the NHS system. So, thank you very much for listening. You can see on the last slide that we have a very good website, And there is a lot more information on this website, and it also contains our report. So thank you very much for listening.
Great. Thank you so much to our speakers today for such insightful information presented about self-care. We do have some time now to go through questions. There's a few that we have that we'll get started with, and feel free to send across any in the meantime as well. The first question I'd like to ask is for Dr. Hamali Patel. So how do you think self-care actually enhances the practice of medicine rather than minimizes the role of the physician?
Yeah, I think that's a great question to comment on. I know that a lot of my colleagues, the advent of technology sometimes can be scary in the sense that there's been discussion, will technology replace clinicians? And I think if anything, technology will just enhance our jobs and make it more satisfying in a time where physician burnout is a growing problem. Bringing back the art of medicine and bringing back the provider to the bedside of the patient and really spending time with your patient has been augmented and allowed by technology. I think we also see flexibility in physicians to not necessarily be in a clinic. There's so many different practice models that technology has utilized and has allowed us to have, and having that level of flexibility and having to not necessarily stare in front of a computer and actually be with your patient and enjoy that experience lends to overall improvement, I believe, in the relationship that you're trying to develop. And that's the really key point, is you still need physicians to be helpful with their patients and really explain and educate them in a way that's useful. I think now you're just being able to have technology assist you so you're not spent doing the busy work and really focus more on the person who's in front of you.
Do you mind if I add a little color to that?
Sure.
Yes, absolutely.
I just was, it made me, as you were speaking, Dr. Patel, it made me think about the relationship with your financial advisor or wealth manager. And while there are lots of tools, right? We could always get, Quicken, right, and work the spreadsheets out ourselves. But when you're able to sit down and have that conversation and drive a little deeper and get to some of the core or some of the dynamics that are not just about the symptoms, like the signs and symptoms are superficial. When you really think about all the underlying dynamics that might be the cause of those symptoms arising, or even those symptoms not arising, right? Why is an individual presenting themselves, feeling the way they feel, and yet no signs or symptoms seem to be apparent? Being able to know that you have now you can afford the time to be exploratory and investigative, become the Sherlock Holmes is kind of, that's an exciting place for medicine to get to, right?
Oh, absolutely. Yeah, I mean, you touch upon that really well. And I think that is really fun. I mean, before you would only have 15 minutes to spend with your patient, and it would be very quick in and out. And it would be one chief complaint, and what the patient is telling you may not necessarily be what you're actually seeing or what is actually going on with them. But you're, charting, and you have to go through a certain amount of metrics, and you need to make sure that you're at least stabilizing the patient. But now you have that time where it's not spent in front of a chart. You can actually look at your patient, observe. And going back to the very early days of medicine, that was part of it, was the observation of the patient, to actually have that conversation and have a better understanding. And so you're detecting things that might not even be on the patient's radar, that might be actually the unifying theme of what they're coming in for, instead of you focusing on, let's just take your blood pressure and let me adjust your medication. So from my perspective, it's actually enhanced and really made me enjoy my practice even more.
Great, thank you both. And the second question I'd like to ask to Fran. So Fran, if you could speak directly to physicians, what critical components would you want physicians to be checking with their patients to ensure that they will actually be able to use any recommended technology successfully?
Well, I think it just goes back to understanding the world of that patient, right? Like if you're going to put a technology or insist that a technology be utilized, that you really understand the dynamics of the person that you're working with. So if you've got, as an example, someone who is highly, mobile or is in an unstable environment, how conducive is that as a vehicle? While I, represent a technology company, I come with an epidemiology cap or feather in my app, if you will. And so I'm thinking more about the overall dynamics of the world of that individual. And when we think about the other social determinants of health, those things have to be taken into account, even when we place on top technology. Just putting it there doesn't mean that it's necessarily going to work. But the other thing, last thing I would just comment on with that is that we just right now, I think the biggest thing is just more physicians recognizing that there is low risk with the technology, and to be willing to take it on. Like that's what we need the most, and to be encouraging of patients who want to participate in self-care. I've seen where some clinicians are literally a blood pressure monitor that you can source from your pharmacy, right? They'll say, don't bring me that data. I don't want that data. And it's like, these are like supposedly the #1 recommended, blood pressure monitors that are on the market, and you don't want the data coming from there. Your patient has to actually show up in your office for a blood pressure check. I don't get it. So there's something fundamentally wrong that's happening here. We need to focus on building the confidence of clinicians because the technology is capable of doing a lot of good.
Fran, just to add to that, from a clinician standpoint, the patients are also driving this. And so physicians do need to pay attention and want to get involved, because we're the ones actually using this. And so we can, and we do have a say in how technology should be developed to actually help improve our experience. But patients are coming in with this. And so if you don't know how to utilize something that a patient is bringing into you, that's where the experience, the relationship is lost. And from a trust standpoint, then it causes patients, I believe, to feel a little fearful if they're bringing in a device that they're super excited to use, or they're checking their blood pressure at home and the clinician is saying, no, I don't know how to use this, or this doesn't really work. I mean, patients are driving this, consumers are driving this, and so to be relevant in our field, we absolutely need to be paying attention and start taking the reins on this stuff.
I totally concur. I totally concur. And if someone is motivated by nothing else, let it be by their competitive stance. If you don't embrace it, they're going to go somewhere where they can. And if at the end of the day what we're most interested in is the safety and well-being of patients, then it is a necessity to come on board.
100%.
Great, thank you both. And then I'd like to ask a question to John as well. So John, when it comes to developments being made in digital triage that you spoke about, I guess there's still unfortunately nothing stopping people from ignoring the recommendation that's been given to them through that and continuing to depend on an opinion from their GP as a trusted source. But how do you think this problem can be tackled so people can shift their trust to other resources where they're appropriate as well?
Yeah, I think it's a great question. I mean, I want to see pharmacy become the front door of the national health care system, so the front door of the NHS. So it could be a bit of push and pull. How can GPs think differently and start encouraging people to go elsewhere rather than coming to them? So in Germany, they had something called the green prescription, whereby they encouraged individuals that were coming in for self-treatable conditions. They gave them a self-treatable, a green prescription, and that recommended an OTC product to them, or in certain situations, it also gave them prescribed a behaviour change, such as healthy eating, or increase in exercise. So that is getting the GP to move people away from them by giving them a piece of paper that encourages them to go to their pharmacy. Obviously, we want to continue to see the triage that's directing people to the right place. And for self-treatable conditions, for me, that's got to be the pharmacy. And if you make pharmacy the front door of NHS, then they've got to be able to show that the patient, the consumer, the individual, that they've got the confidence and the knowledge to be able to help that individual. So how can we help pharmacists do that? Giving them right access to patients' records will go a long way in being able to show to people that the pharmacist is the front door and has right access to their records. But also giving pharmacists all the knowledge of what's happening in the local area, and then giving them the ability to refer people to other healthcare professionals fast-tracked if necessary. So is there a local physiotherapist? Is there a local place where they can get some exercise? Or is it important that they need to see the GP and they get them fast-tracked? So I think it's a bit of a push and pull, pushing people away from the GP and pulling people into the other sources, particularly the pharmacy, and using it as a front door.
Well, you know me, this is Fran, I have to make a comment. John, I totally agree with you. And, you know, it's not a competition, right? What we're looking at is a model, you know, self-care, and a model that's truly centered on patients being at the center necessitates the team being rallied around that patient, and not a tug of war over who has the, you know, the ultimate authority on, you know, the care of that patient. The interest should be the patient first. And I think back to my years in Australia and the Pharmacy Guild and the efforts that they were making, and the model that shifted. You know, we talk about over-the-counter products, but what about over-the-counter pharmacists? And I'm seeing pharmacists playing a role directly in the community, even visiting with patients in their home. It's an amazing dynamic that has proven to be quite successful. And I think if we put our emphasis on the patient, right, and truly the patient being at the center of care, then some of this controversy sort of should fall away, in my opinion. I don't know. What are your thoughts on that, John?
So I absolutely agree. It isn't a competition. I want to see in the local areas everybody working together. And I want to get people before their patients. I want people to start thinking about who do I speak to look after myself. And that's why I want to see all these apps, these wearables, and wherever they go, that there's got a reference on how they can look after themselves. And if they're not sure, they can go to their pharmacist for that little bit of guidance, that little bit of advice. But I want to get them before their patients. I want them to be able to think about living well, healthy living, eating well, doing their exercise, looking after themselves. And everything must be focused on in telling them how to do that. And if they need some guidance, not running to the doctor every time, going to the pharmacist, and all the healthcare professionals in the local area working together and putting the person at the center to making sure they give them the best possible service.
Mm-hmm. So, you know, yeah. Dr. Google is number one, right? Like, if you look at the searches, the results universally, the number one searches are health-related searches, and some of that information is good information, some of it's not. So you definitely need a source for that. Sorry, you were going to say something, Dr. Patel?
Oh no, I agree with what you both are saying, and you know what I've leaned on my pharmacists and community to some. I mean, it's from a clinician standpoint. Also, we learn from each other, and so. And we're not supposed to know everything. And so I think that it's actually, when we look at like multidisciplinary care, especially in the hospital, pharmacists were pivotal and are pivotal to the overall care of our patients. And we would actually do rounds at Stanford where pharmacists would follow you inside to the patient room when you're rounding with your patients, and they would go through a medical reconciliation, and they would say, do you want this patient on X? Because as you know, their platelets are Y, and it was actually really helpful. It's like another set of eyes on your patient, and we're learning as well. And so, and you know, in the outpatient clinic setting, there are multiple times where I'll call my pharmacist to understand a little bit more about the, you know, medication side effects of X, or, you know, just have a frank conversation about what's the typical way of ordering a specific medication. And it's really creating a multidisciplinary use case for your patient, where the patient's at the center of care, and it's very coordinated between pharmacists, physicians, social workers, case managers, really extending outward. So I completely agree. I think that it's very important from a safety standpoint as well.
Great, thank you very much, everybody. That brings us to the end of the questions for today's webinar, and thank you again so much to our speakers today. Thank you so much to everyone online who joined us today as well. You will be receiving a recording from the webinar, and when you receive that, we're always happy to receive any feedback that you might have as well. So thank you very much again, everyone, and enjoy the rest of your day. Bye.
Bye. Thank you.
Thank you.